Let's welcome in right now registered nurse Arlene Ramirez. Arlene is the director of patient care at Long Island Jewish Valley Stream. She's also the first Northwell Health nurse to receive the Moderna vaccine. Arlene, thank you for joining us.
Thank you.
Now, before we begin, I know the issue hits close to home for you, for your family. Tell us a little bit about how you've had to battle with this virus as a family.
Yeah, as you said, unfortunately, at the end of March and through the month of April, I contracted COVID, was severely ill myself, my father as well, with 36 days in the ICU at Valley Stream, in addition to my father-in-law with almost 3 weeks of inpatient stay. Through my illness, I endured high fevers, anywhere from 7 to 9 days, vomiting, nausea, headache, joint pain, a lot of weakness. I could barely breathe. It was either I coughed or I breathed, not both. It was horrific. It was horrible.
So you went through all of that. Then the virus comes on the scene. It gets emergency use authorization. And you hear a lot of people say, wait a minute, I don't know if I want the virus. I don't know what it's going to do to my body. How do you respond to that? What can you tell them now that you've received the Moderna vaccine?
I am fine. The Moderna vaccine for me is hope that we will put an end to this pandemic. With the vaccine, we know what we're going to get. Maybe a day of fever, a day of headache, a little fatigue. With COVID, you don't know where you're going to get. I've seen people clinging on to life, people losing their life, families destroyed, whether directly affected or indirectly affected. We don't know what you're going to get or what the outcome is going to be after you contract COVID. Yet we do know that these vaccines are above 94% to 95% efficacy. We know that we're going to reduce severe illness, and we know that we are going not to be a vector of transmission to our family and friends.